So very, very relevant question. And I think patient safety is paramount when it comes to diagnostics. Now, for anyone watching this and for them to take home a message, is that whenever anyone gets any test done, may it be at home or maybe you're walking into a lab, just try and remember this mnemonic that's called SAFE-D. So that's safe diagnostics, where S stands for sample labeling. So when someone's drawing your sample, just check the name on the vial or the container in which they're collecting your stool or urine. So it's very important to check your sample labeling. All of you should know that the maximum errors in any lab globally happen when you are labeling the sample. The second one is ask instructions. So some tests that require to be fasting, some that don't require to be fasting, some that are supposed to be done after a couple of hours of you finishing a meal. There are some tests that can only be done in the afternoon, some have a specific time, etc. So always ask instructions, because that is again paramount for you to get a very accurate report. The third one is fresh needle assurance. Now, with so many labs cropping up everywhere, if you're getting tested at home or in a lab, make sure that the needle that they're using to draw your blood is sealed and a new needle. So always remember that. The fourth one is ensure infection control. So what I mean by that is that suppose you're getting a home collection done or you're walking into a lab. There have obviously been more patients before you who would probably have like a fever or any other transmissible disease. So make sure that the person who is taking your sample is wearing gloves, is wearing a mask, and is also sanitizing everything that is coming into contact with you, because again, your safety is the highest priority. The last one, that is the D, that is the safe diagnostics. The D stands for details. So try and give maximum details to the lab, your doctor's advice or your prescription, so that they can clinically correlate the results. You can also tell them if you're very thin veins, and previously if someone wasn't able to draw your blood well, we have thinner needles as well that can be used for that. Also, very importantly, if it's a baby or a child who's getting sampled, make sure that they have a specialized pediatric phlebotomist, or when you're coming in, the pediatric phlebotomy team is available. So in short, safety is paramount, guys, but just try and remember S for sample labeling, A for ask instructions, F for fresh needle, E for ensure infection control protocols, and D for details. Get as many details. And trust me, if you remember this, you're not going to regret it. Wonderful question, and this is something that is not spoken about that much, but adding value to the patient's care continuum is something I feel that is again very important for diagnostics to provide. Since diagnostics is the first touch point in the care continuum, as in if you get a fever or if you need any kind of a test or if you want to check your blood sugar levels, someone's diabetic, the lab is the first touch point that you go to. So wherever you go after that, or in other words, whatever your doctor prescribes from a management perspective, depends on what your lab report has in it. So you must understand this, that your lab report is not just a paper with something scribbled on it, but it controls your entire health decisions that the doctor is going to make. So be very careful when you choose your lab and make sure that you choose the correct lab.